What are the arguments for having bilateral cataracts on the same day? Well, the main argument is convenience and ease for the patient. Effectively having it on the same day means that the eyes get treated at the same time, and it's faster recovery, less burden for the patient, less number of appointments to see the doctor, and they can get on with their lives faster. So that's the main reason why people choose the same-day surgery. What did this study find? Well, it was a large study, as you mentioned, 1.8 million people, and what they did was they compared same-day surgery against two groups of delayed surgery. One was short, less than 2 weeks, and the other one was a long delay which was 15 days to 90 days. But what they found basically was that the delayed groups, both of them, had a slightly better visual outcome, only a small amount, 3 letters, but there was a higher proportion of people. So half a line on a standard chart, but 6% to 10% of people had perfect vision or better vision in that second eye compared to the same-day surgery group. So was that significant, that reduction in visual acuity? Well, I think it really depends on the individual. If you've got perfect vision, a half a line difference is a slight fuzziness when you are looking at distances. So, the vision is still very good but it's just not perfect. But the main issue is, say, someone has got other medical problems and their vision is not great to begin with, even one letter or half a line will make a big difference for them. So I think it depends on that individual patient. What you're saying here is that some people who get a cataract done have already got, say, retinal damage or other things going on in their eye, which means that even when you correct perfectly, you've still got a problem left. So if they've got an underlying medical thing. And the common things that we see are glaucoma, macular degeneration, diabetic disease, it limits the potential of the eye to see. So even perfect surgery won't give perfect vision. What's the practice in Australia? The vast majority of us prefer delayed surgery, and the majority are in that early delayed group, so most of us are within 2 weeks of surgery. Sometimes it could be a bit longer. There is only a small proportion who really do bilateral same-day surgery. The main advantage of that is that the formula. So to calculate their intraocular lens, that plastic lens that you mentioned in the intro, you have to use complex formulas to figure out what lens to use, but that formula is not 100% accurate. It's pretty good, but there is a proportion of people where it just doesn't work as well as we hope. So you can fix it up in the second eye. Exactly, so we do one eye as a test, we find out whether their eyes behave as the formula predicts and, if so, great. But if not, we can make adjustments so that second eye turns out better. And the same-day surgery doesn't let that happen. Is there much risk of complications? In other words, if you do both eyes at the same time, is there a worry that you could get double the complications? There is a small risk, but that has been mitigated. So the big thing that we worry about is an infection, which is rare, but if it does happen it can be devastating. And if both eyes are operated on, the risk is that it happens to both eyes. But what those who do same-day surgery do is that they use completely different equipment for the eyes, so effectively the risk is mitigated, as if it was done on separate days. So if somebody wants that convenience, or a health system or an insurer wants that convenience, what's the message for consumers here for somebody who has got bilateral cataracts? Which most people who have got cataracts, they are bilateral, both sides. So for the vast majority it is bilateral. I guess what we often say is talk to your doctor and your ophthalmologist about it. The vast majority will urge you towards having it done separately, for the reasons that we mentioned. There is better accuracy by being able to do the second eye slightly later and seeing whether the calculations are correct. But if it is a big priority, and there are certain situations, for example, they can't do multiple anesthetics, for argument's sake. In that situation it is a calculated risk and they need to realize that there is a chance that the vision is not as good as it